Welcome back to The Factor on Censored Now. One of the services that kept people healthy during the pandemic is now going away, at least potentially. We're talking about telemedicine. Joining us to talk about the pros, cons, and tips for those change is Dr. Danish Ali with Archpoint Pain Institute. Dr. Ali, we know during COVID, a lot of older people and young people, but mainly older people, depended on telemedicine to help with them with their doctor's visits. And in fact, it made it easier on many of them because they didn't have to find a ride or transportation for their doctor's visit, but that could be going away, right?
That's correct, Isiah. With COVID, what we saw was a significant increase in the number of televisits. Lots of providers, even urgent cares and hospitals were providing this sort of service that was covered by the insurances and recognized as office visits. However, those days are now becoming lesser, especially in the coming days once those telemedicine rules and what used to substitute for an actual in-person office visit is likely going to be going away in the coming months.
And really quick, Dr. Ali, who decides that it's going away? Is it the federal government? Is it the insurance companies?
It's a combination of both, Isiah. Initially, the federal government had put it in those rulings, and then some of the insurances have continued to maintain those. And as we know that the Medicare and Medicaid is governed by the federal boards, and so we know it's a combination of both. But like I said, it is now likely in the near future even becoming more and more lesser of an option to patients. Because those rulings are now going away and insurances are now requiring in-office visits, whereas they were initially covering telemedicine sorts of visits for patients. And so what we're going to see is an influx or an increase in the number of patients that are going to need to go to see the physicians, see the medical providers in the office setting.
And so for those who need to go physically to the doctor's office, what kind of options are there out there for them if they are not driving? If they're seniors who don't drive, they may not have family members who are willing to take off from work and drive them to the doctor's office. So what are some of the options that are out there now currently in place before telemedicine and now after telemedicine?
Yeah, Isaiah. So there are many options. One being there is the metro system that provides transportation for patients, and that is calling the metro and giving them all the information, and they will help arrange transportation, especially if the person is disabled or has some sort of a physical disability. Also, a lot of medical insurances, our health providers, insurance providers, do provide transportation as a added option onto what they provide. And so you can call your insurance and ask them, do they provide transportation? And a lot of times they do have that hidden in there that they do provide those services. And some even reimburse you for Uber or Lyft sorts of ride sharing transportations that you may take as well.
And of course, let's not forget about Medicare and Medicaid. The federal government and the state government, they may have some programs that you could possibly call and explore.
That's correct, Isaiah. All of these options we just talked about, whether it be Uber, Lyft, whether it be your insurance transportation or even Metro, a lot of those utilize Medicare and Medicaid services as well. So it's all built in. Call your insurance as a message to see what are transportation options if you're not available. Call your physician as well. Again, these telemedicine visits haven't completely gone away, and there may be something that they can do where instead of seeing you every month, they may be able to see you every 3 months or 6 months, but in between that, they can still set up telephone visits or telemedicine visits with you as well.
Do you foresee there being an extension in this if there is a demand from the public where they will allow telemedicine to continue on?
Yeah, I say it's hard to say. We do know that these sorts of services do increase costs for insurances, even though we know that they decrease costs and decrease ER visits. And so I think it's just going to be it's going to be in the air. I don't know is the answer. I think what they're going to end up doing is going back and forth. Will we get a possible extension? Maybe. Or they may open up the ruling a little bit and say, oh, for a certain period of time you can. For example, every 6 months you may be able to do a televisit. We'll just see how these sorts of things play out in the coming months.
All right, Dr. Danish Ali, Arch Point Pain Institute, thank you for joining us tonight here on The Factor.
Thanks, Isiah.